With mental health covering such a broad spectrum, communities are tasked with meeting a broad range of needs. Bryn Haverkamp is Crisis Director at Pawnee Mental Health, Lucas Moody, Development Director at Crosswinds, and Brad Chapin is with us, Director of Clinical Services at Stormontvale Behavioral Health in Topeka. Welcome to all of you. So you are focused on the Manhattan area. What have you found is the need and demand around the Little Apple?
I would say a lot of it, as they mentioned before, is that transportation need. We're focusing on a lot of mobile crisis support where we're responding to some of our more rural communities without the support of our emergency responders. And I think that is going to meet a lot of needs that we haven't been able to meet before.
And how wide a range of area do you serve?
Pawnee Mental Health covers 10 counties,
Wow.
Anywhere from Raleigh County to Mitchell and Jewell County are more rural areas.
And those rural areas are such a concern. Lucas, how broad of an area does Crosswinds serve?
So we cover 7 counties. Most of them are rural. One of our counties is actually a frontier county. And with our counties, I mean, it's the same thing. I mean, the communication, getting the voice and the word of what our services are out to everybody can be difficult. Getting the transportation to get back and forth to services has been a big barrier for us. Telehealth has changed a lot in that world, and so that helps give access a little deeper and more penetrating into those counties.
What do you mean by frontier county?
So Frontier County is a county that our population density is much different than even just a regular rural county. So population per capita in that county is much smaller.
Brad, you're in Topeka, so you're in an urban community. What are the needs that you see that maybe might be a little bit different, and what are the similarities in terms of challenges that we face even in an urban community?
Yeah, fortunate in Topeka, but we are part of a large healthcare system. Stormontvale covers several counties, so we're also trying to reach out into the rural, also with a large new clinic in Manhattan. But some of the rural challenges, still transportation, if you can believe it or not, is an issue. Homelessness. There are a lot more supports here in Topeka, but I think education. I'm really glad you're doing this segment. I've seen a lot on mental health literacy coming out lately, so I think you're right on trend with doing this, getting people the basic information about how to access services, where to go, when they need to ask for help, and just getting that basic information out to people that need it.
For all three of you, why should this be a community focus? If this is not available in your communities, what's the consequence, Bryn?
The consequences is it's more extreme of a cost to our communities. You talk about first responders, law enforcement, EMS, your local ER. If we don't have the services in place, we are inundating those other services, and then they're not available when they need actual emergency services. So finding the appropriate response for mental health clears that out for the rest of those agencies.
How about for you, Lucas?
Yeah, I always tell them that, my big thing is I want people to be happy, healthy, and safe. And when we find people are happy, healthy, and safe by the resources that we can provide and support them in the manner that they need supported, our communities become happy, healthier, and safer. And so together, all of that stuff kind of makes that perfect picture. Those resources are vital to that.
For you, Brad?
Yeah, I think telehealth was a big piece of it. So that's something that we can provide and reach out to folks that may have a lack of clinicians in their area. We've been doing about 30% of our outpatient visits still have been telehealth, even after COVID has subsided a little bit. So that gives us a chance to reach out to somebody that can't leave the farm to drive to Topeka to go to an appointment. They don't have to leave. Or on days like we had sub-zero temperatures, you can stay home and still receive your visits. So just taking advantage of the technology we've been given.
Are you saying that a mental health crisis doesn't watch the thermometer? I mean, and that's serious. I mean, you have to be able to access it when you need it and not wait for the weather to get better.
Exactly, yes. And to have that option, it's been wonderful to reschedule appointments on days like that. Has been great for patients.
Well, access is a big issue. I thank all of you for giving us a little bit of insight into what you're doing to try and overcome some of those access challenges. Thank you so much. Well, meeting needs means focusing on all ages. We will examine when that brings special considerations for children and teens next.